Record now. So over to you.
Wonderful. Thank you very much, Richard, and pleasure to be here. Great to see you all. So my name is Jack Pottle. I'm founder and chief medical officer of Opt Medical Simulation. So we're a virtual reality healthcare training company. And I will be talking today a little bit about VR in general, VR in healthcare, VR in nursing, and also some of the work that we're doing with Northampton. So we are working with Northampton. So when that was presented, that would have been our platform. But I'll try and be more general, keep it more global, and hopefully answer your questions around virtual reality in healthcare, how it's used, how it's integrated, and the benefits of it. So please do ask any questions as we go through. Hope to be taking questions at the end as well. So a little bit of background to kind of how we got into this. So I started life in educational psychology, then worked in psychology for a little bit, ended up becoming a healthcare assistant, so working in hospitals, doing the kind of lower level bits of nursing, and then ended up studying medicine and became a doctor in acute hospital medicine, where I was working for 5 years or so. And I did that mainly in London, but worked all over the world. So I worked in Belize, Thailand, in South Africa, doing doctoring on the front line and seeing different healthcare systems, but similar problems no matter where you went. And there are the broader problems, of course, of funding, of not enough staff, too many patients. But there's also the more immediate problems for doctors and nurses of the fact that what they are often trained in at medical school or nursing school is more in a way to pass exams and isn't necessarily as practical to real life as you may imagine. And there's always been this thing in medicine of you actually learn by seeing one, doing one, teaching one. See one, do one, teach one. And we used to think that that was a reasonable way of teaching people until you stop to reflect that you're practicing on patients and there is patient harm created through that. And therefore you can't teach people effectively in that two-stage system of saying, we'll teach you to pass exams and we'll let you practice on patients. And so over the last 10 years or so, medical and nursing education has begun to change. And we've said, okay, there's got to be a different way of doing this, a different way of training people. And that is partly where simulation has come in. So hopefully you can all see my screen now. I appreciate, as Rory was saying, it's a diverse audience we've got here. So hopefully I'm not going to teach people to sign. Simulation is one of the key ways we teach doctors and nurses nowadays. And really it is by using mannequins, by using actors, and by letting people practice not on patients, but on a simulated patient. And it is widely used throughout the world now as a way of teaching people. So you can see here a plastic mannequin in the top right-hand corner, lots of people listening to his chest. You can see in the bottom left-hand corner, a patient. So this is a simulated patient, not a real person, someone that you hire in to come and teach people how to do exams. And these simulations...
Sorry.
Yeah, sorry.
Sorry, it's okay. The screen's coming up okay, but you're breaking up a little bit. I just thought maybe if you turned your video off, that might just save some of your bandwidth, if you wanted to try that.
Can do. I think if I turn just my video off, I may disappear altogether. Let me try that. Are you still able to see that?
Still there,
Are
yeah.
you able to see that okay?
The sound's okay, yep.
Fine. I will keep talking, but please do carry on giving me the nudge if you do lose the sound on that.
That sounds much better.
Fantastic. Good. As I say, Northumberland internet, not what you might expect somewhere. So simulation, mannequins, actors, patients. And it's often done in these simulation centers. So you can see in the bottom right-hand corner, there's a control room where this picture is taken from, and they are looking out onto that patient where there would normally be students practicing in that. A way of giving people really a higher stress learning environment that reflects real life. And simulation works really well. It is a great way of training people because it's basically learning from experience. But as with everything, there are issues with these ways of teaching. And the biggest issues with things like simulation are the resources that you need to be able to do it. So it's about getting the faculty in to be able to run it. It's about getting the materials. You know, these mannequins cost £80,000 to £100,000 to be able to buy a good mannequin. The time taken to be able to train people up, the space, the scheduling of being able to put people in there at the right times, and also the senior support to be able to drive that and deliver it. So Essentially, very effective way of teaching, does improve patient care, which is what we are all setting out to do, but is expensive and difficult to deliver. And I was a physical simulation instructor at University College London and was looking at this and thinking, is there a different way of delivering this kind of training? Is there a different way of scaling that delivery of simulation to democratize it, to get it to people in their own homes, but also to get it to people globally, and to think, let's train doctors and nurses in a broader kind of way. Obviously, there's a number of ways of delivering training that is more scalable. And one of these is screen-based, so it's e-learning. And there are programs out there that exist to give you a sense of what it's like to be treating a patient with e-learning. And it's good for accessibility, good for getting the word out there. But as we all know, anyone who has been through an e-learning package, often you'll speak to one side or a glass of wine going through your e-learning. And if you really want to give people a sense of learning from experience, they have to be more immersed, more engaged in that scenario. So we began looking for other ways of doing this. One of them is 360-degree video. You may have all seen that. It's essentially a way of filming a video and then being able to watch it back afterwards. Works well in terms of giving people an experience, does not work so well in terms of interaction, because that video is all filmed, so you can't necessarily interact as you would do in real life. And the other way is virtual reality, so immersive virtual reality. And you can see here a few pictures of people using it and what it feels like. And the best way of describing this is it's virtual reality video gaming. So instead of it being a game where you're maybe doing a shoot 'em up or you're fighting someone, you are playing the role of the doctor or the nurse in that scenario, and you have to do whatever you would do in real life. So for example, a patient will come in, you have to speak to them, take a history, communicate, examine them, do investigations, and treat them as you would do normally, and then you get feedback on your performance. And that is a way of delivering immersive training at scale. Now I'm going to pause there and briefly talk about different kinds of immersive training for people that aren't aware of what the immersive world is like. So there is virtual reality, there's augmented reality, and there's mixed reality. And I'm not going to get too technical on all of these, but essentially starting with augmented reality in the middle, this is digital content on top of your real world. And that can be in the form of really anything. It could be in the form of a head-up display on a car. It can be in the form of, for example, Pokemon Go was an example of augmented reality. When you look on your phone and you see a little Pokemon implanted in the real world. That is augmented reality, but it's also used in healthcare. And the key is that you can still see your real world, but there's a digital something on top of it. The opposite of that is virtual reality. In virtual reality, the entire world is digital. So you put on a headset and you are in a virtually created world. And what that means is essentially you are virtually transported to any place that you want the learner or the user to be. Whereas augmented reality, you have to be in the right setting and then overlay objects. Augmented reality, the most famous one of these is Microsoft HoloLens. This is an augmented reality or a mixed reality headset. Augmented reality and mixed reality, the terms are sometimes a little bit mixed. And this is an example of its use in practice. So this is someone with a Microsoft HoloLens headset on, learning anatomy. So they're in a normal room. They're in an anatomy room. They have this mannequin presented. It's a really nice, because actually you can gather a group of students around that person, all looking at it in real time and all discussing it. And I apologize if my internet connection is unstable. So that's augmented reality. Mixed reality is very similar to augmented in terms of how I showed you this, but that object, so that digital patient, would be maybe interacting a little bit more with the environment. For example, if you walked in front of a chair, they would be hidden behind the chair. Virtual reality is a very different way of looking at things and is what we do at Oxford Medical Simulation. Lots and lots of different ways of delivering virtual reality. The ones that you may have seen cardboard, Google Cardboard. This one in the center. It was put your phone in it and get a sense of what it's like to be in virtual reality. It was good to get the word out there, not good to actually make people feel like they're in that world. And so lots more virtual reality headsets have been developed. Most of them now are very, very good. And the price has come right down to make them affordable at scale, which is what we're doing here. One of the best ones is the Oculus or Oculus Rift headset. So you put this headset on, two displays in the middle of it, got your headphones on, and it really feels, by putting that headset on, like you are in a different world, and you're able to interact in that world like you would do normally. So here's someone with hand controllers. They're able to interact with the virtual objects in that virtual world. Hopefully, that gives you an overview of simulation, medical and nursing education as a whole. It gives you an overview of augmenting immersive experiences. Now, at this stage, I sometimes stop for questions, but I'm going to just push on for now, unless I'm interrupted by anyone, partly because I can't see your questions coming in the way I've set the screen up now.
No questions yet, Jack. It does keep dropping out intermittently on the sound. I don't know, is there anybody else in the house you can kick off the Wi-Fi?
There is not, I can assure you, that is not the problem. It is just the Wi-Fi in my dad's house is just terrible. No. So I apologize to everyone. It's a horrible experience to be looking at, but there's no way of improving it more, I'm afraid.
Everyone's still online, so don't worry.
Good, okay. So what do we do as a company then? So for us, it is about delivering healthcare scenarios using virtual reality. So you give nurses, be that student nurses or nurses on the wards, you give them the benefits of traditional simulation, and you do that in a way that's scalable, so you can get it to more people. And you can see here one of the nurses in Northampton in virtual reality going through one of our scenarios. And this was a while ago. And the whole point of the way we do this is to let people practice, learn from their mistakes, and improve patient care. That is the outcome of all of this. It is not about teaching people to be able to pass exams. It's about letting people make mistakes in the virtual world so that they don't do it in real life. The way our scenarios run, the learner puts on the headset and goes through that virtual simulation, and I'll show you what that looks and feels like on screen shortly. They then get lots of guided reflection, the ability to talk about what they think went well, what didn't go so well, and then a huge amount of metrics on their performance. So an ability to look back and think, okay, what did I do well on? What didn't I do so well on? How can I improve that over time? So that they can then go back into that scenario and begin to improve. And it's those elements of gamification. I want to improve, not only because I want to improve patient care, but I want to be improving my score over time. As Rory was saying, human beings, much as we think we are complex, are actually pretty simple in how we run. And a lot of that is, if you give people a score, they will want to improve on it. So we build those elements in as well. Okay, scenarios themselves. What I'm going to try and do, and I apologize if the internet doesn't let us do this, but I'm going to show you one of the scenarios and we'll see if it works. So I've just dipped out of that and I'll go into one of these scenarios. So this is one of our nursing scenarios that I'll take you into. And as I say, we are playing here the role of a nurse. We've been given an orientation. We're going to be in a handover by the nursing assistant, and we're going to be seeing our patient as we would do normally in clinic. So we are seeing someone who's come in generally sick. He's unwell. He's, I believe, got a temperature, this chap, and then we'll see how we interact with him during this scenario. Here we go.
Hi there, I'll be the clinical support worker helping you today. Thank you for coming to see this new patient. I'm really worried about him. His name is George. He's just come into the department and looks very unwell. I've reviewed him a little, but not gotten much background information yet. Can you please see him now?
Hi George, I'm one of the nurses looking after you today. We'll try to get you feeling better soon.
Hi there, thanks for coming nurse. I feel terrible. I hope you can find out what's going on.
So as you can see, I'm here in this virtual environment, and I can move around it as I would do in real life. On screen, I'm just moving with my mouse pad, but in the virtual world, I would be able to just walk around this room normally. And I'm really able to do most things that I would do normally. So let's talk to George.
I was fine yesterday, but started feeling a lot this morning. I've been hot and really shivery for a few hours. I've never felt this unwell before.
That's the ECG done. I've left it on the desk for you.
So you can see here, and I hope it's not too jerky with the internet and that you can hear it okay, but you can see how I can interact. So I can talk to him, I can do investigations, let's check his capillary blood glucose, and let's do some observations on him as well. Let's pop on blood pressure. He's got normal blood glucose, and I'm able to then do things like measure his oxygen levels. And you can see from going through this, I'm getting the experience of doing what I would do normally. I'm taking a full history.
Tell me what medications you're taking, please.
On the last time that came, I was on the way with the list of my tablets.
And again, I can do examinations. I'm going to be able to treat him. I've got all of the medications here if I need to. I'm able to listen to his chest. There we go. And if I decide that this chap needs a little bit of oxygen, let's pop on some oxygen as well. Obviously, there is a huge amount more that I can do in this scenario. Anything on the computer I could look at. I could document his early warning score, all things that are really important in nursing. COVID, I believe I can go on to do this. I'm just going to wash my hands. So I leave the scenario very briefly. Clearly, my nursing skills have deteriorated over time, and I'm going to leave the scenario. And I'll skip through these. And my internet may well have dropped out, but let's see if we can get the feedback on this as well. So I'll now be able to go through the feedback in terms of what we do, and I'll be able to see every single thing that I did in that scenario linked out to blended learning, so I'm able to then review that in my own time. Let's have a look. You can see it gently churning away. So this is the feedback that I get looking at every single thing that I was doing, my technical skills and non-technical skills, both of which is important in nursing. So it's not just the decisions that you made in terms of asking the right questions, it's how you ask them, how you engage with that patient. Did you provide them the right assurance? Everything that you guys as patients might expect people to do as nurses, we do pick up on that and give people feedback about it. And they can then learn about all of these elements in here. And then, as I said, right at the end, we then give them a score to be able to see how they did. 36%, I'm disappointed in myself. So that's how it works in terms of the scenarios. And we've got lots of different ways of making this more engaging. So the idea of being able to say, well, actually, we can make these patients look really sick if we want to. Making people look ill is a really good way of getting people engaged over time. So you make them sweaty, pale, clammy. It really makes doctors and nurses worried, because that's what we used to see. And we want people to be a little bit stressed in these scenarios. You learn better in environments where you are a little bit stressed, you will, in a similar way to how you learned it. So that's why we get people a little bit stressed by it. What I showed you there was the single player version. So that's one person in virtual reality going through a scenario. We do also have a multiplayer version for those who are into gaming, which is much more about interprofessional learning. So it could be a doctor, a nurse, a pharmacist, a physiotherapist, all in that scenario together, all treating and learning from that patient. And then they all go back out into the virtual debrief environment to be able to discuss that case again. And in simulation, this is where a lot of the learning happens. It is not about purely in going through that case. It's about the feedback that you get from it. It's about that engagement afterwards. It's about the discussion of what could we have done better? What went well? What didn't go so well? Let's talk about it. And equally with that, to be able to support people, some people get very stressed in simulation. They don't enjoy that experience in physical simulation. And in virtual simulation, you have a bit more space to be able to engage and enjoy it. It is a genuinely enjoyable experience. And then this is an opportunity for people to talk, to consolidate their knowledge afterwards. I can maybe show you a video of the interprofessional one, if it all holds out as well. Let's try this. Here we go. So this is the interprofessional version. And I'll turn down the volume slightly so you can see there's a number of people in that scenario talking to each other and talking to the patient, and then they are debriefing, so going over that scenario together. I'm going to stop that again because I appreciate that my internet is again becoming unstable. Again, further apologies for that. So if I can load this back up, hopefully that gives you an idea of the single player and the interprofessional version. And again, in terms of how nurses and doctors learn, we learn better from working with each other. We learn better from that reflecting a real life way of learning. And so that's what we do in our scenarios. Lots and lots of different scenarios, pediatrics, mental health, adult nursing, and we do them for medicine as well. And we work in the UK, we work in the US, we work globally in terms of what we do. But this, particularly because this is a digital Northampton event, this is what we're doing in Northampton. So on the left-hand side of this picture, you will see at the University of Northampton, we have mannequins. So this is physical simulation with mannequins and with actors that would be in these scenarios. And on the right-hand side, we have the virtual simulation. So we have 4 different sets of hardware, all of those scenarios projected on that wall so that lots of people can go through those scenarios together, can engage and then discuss that case. And this works really well to be able to get people through simulation quickly and effectively. And this is now being used across the board in Northampton to teach their nursing students. And as was mentioned earlier, a lot of people, say 2 years ago, won't have picked up on virtual simulation. They'll still be working with physical simulation or with book learning. Very much over the last few years, people realize this is a way of scaling it. And particularly in, I know it's been said a lot, but in the times that we're living now with social distancing, virtual simulation really is a way to actually democratize that learning and to get it to people who otherwise wouldn't be able to come in and learn in the same physical space. They can learn in the same virtual space now. And that's the exciting place to be able to give people that opportunity to learn that they wouldn't otherwise have had in any other way, shape or form. And for me, that's what we should be doing as an industry with virtual reality, is being able to train people in ways that actually improve performance and in ways that can't be done by other kinds of technology. So that's the way we deliver things. This is another nurse using it at Northampton, and really interesting in terms of how people implement it and integrate it. I'm happy to talk about this at length, but I appreciate I'm going to be going well over time, so I'm not going to go too much into how they structure the teaching. But the point being that people, both the learners and the faculty, really enjoy this as a way of training. It lets them integrate theory into practice, allowing progression through their academic career. And that's a wonderful thing to be able to see. And I should pause here and say a shout out to the people at the University of Northampton. The way this is implemented is not only about our software, it is a lot about the faculty and the way they engage with it. And the faculty at Northampton have been absolutely fantastic in engaging with this and getting it out there. And their students are really responding to it. So well done there. And we're not just in universities, this is being used, so virtual simulation is being used, as I say, around the world, but also across whole regions in the NHS. So we are using this with every hospital in the east of England, for example, so 18 different hospitals, everyone in virtual reality. You can see here in the bottom left-hand side, they are in a classic NHS cupboard to be able to learn, but everyone in virtual reality, learning as they would do in real life, but in virtual reality. Let's skip through the testimonial. I'll go back to this testimonial, mainly because I just love it, blowing our own trumpets. Honestly, this is the single most useful learning experience I've had so far in my medical training. It's a wonderful thing to be able to hear and makes us think that actually virtual training is the way this is going. And worth saying, I don't mean to say the way this is going in terms of replacing physical training. I do not think that virtual reality training should replace either physical training or clinical training. It is about finding the place where it fits into the syllabus and saying there are things that virtual training can do that physical training purely cannot do. And there are also things the other way around. Virtual training is not yet good enough to be able to train people on the subtleties of communication skills, of how to break bad news to a patient with cancer, of being able to do all of those subtle elements. But it's incredibly good for getting people to focus on decision-making, clinical reasoning, critical thinking, getting them to go through realistic scenarios and to repeat those over and over again. So that's where the place of virtual reality is in general. Disadvantages of virtual reality, probably worth mentioning. Obviously it's very expensive to build it in the first place. This is high quality video gaming, so it's expensive to build it. But once it's built, it's really good at just being able to lower your costs. So it is much, much cheaper than physical simulation over time. And the other one is headsets. Of course, you need to buy the headset to be able to use it. But again, prices for them have come right down now. It costs about $400 for some of the headsets, or £300 or so for some of the headsets. That is it. I could talk lots more about the evidence background behind all of this, but I often find it's better, particularly with a varied audience, for me to stop talking and hopefully answer any of your questions around this as we go on. So I will pause there, and Richard, take any questions from you guys.
Brilliant, Jack. Well done. Even though you dropped out now and again, when you got to playing some of the videos, that was a bold move to play the video with no Wi-Fi, but it looked amazing. The comments were really good. So well done for that. Got some questions. Do you have to keep updating?
Richard, I cannot hear you if you're talking.
I think my mute is off. Can you hear me?
Apologies, it was a problem from my side. I can hear you, sorry.
Yeah, I was going to say, brilliant. We had some really good comments there. It worked really well, even though it was dropping out. When you were playing the videos, it came across really well. So well done for doing that. Got some questions for you. Do you have to keep updating the VR scenarios as new treatments approaches are developed?
Yeah, absolutely. So that is a job for us. We have a whole clinical team who design the scenarios, and they do the updates automatically in the background. So yes, absolutely, it needs to be kept updated. And again, another good thing about virtual reality, you make that update, it immediately goes to everyone across your trust, across your region, so you can then train people in new, updated ways of treating people very effectively and efficiently.
Yeah, it's fantastic that it's being used in Northampton as well, our university, for our students. Another question.
And they were, Northampton University, again, just to give them another big up, were one of the first, I think they were the first nursing institution in the world to embed this properly with their course. So they've really been a driving force behind getting virtual reality nursing simulation out there.
Yeah, great. I know that they did the demo last year at MERS Futures. I didn't see that one, but yeah, we'll have to revisit some of that stuff. Shelley asked about the devices. Is the Oculus Rift the one that you mainly use?
It is, yeah. So there's lots out there that do different things. There are lower end ones that are cheaper and give you a slightly worse experience. And we are much more about giving people the best experience we can do. So the two really good ones are Oculus Rift and HTC Vive, if you're looking to get the good ones. PlayStation VR is also quite good. So we use Oculus Rift S because it is the top of the range one. Yeah. But there's lots out there.
In terms of the technology that you're using then to build these environments, I mean, that was one of the reasons why we called the event last year Merge Futures, was because no matter what background you're in, the technology is converging, and the future of whatever role you work in, you're going to be using this kind of tech. It's advancing so much, and you've got the gaming environments, the special effects in films. Will you be evolving that software to keep up with those trends? And then does that mean that you have to keep rewriting it, the cost of doing that? You know, I guess it's a big commitment to do it long term.
It is, absolutely. You know, we've always prided ourselves at being at the forefront of this. We are one of the global leading companies in doing healthcare simulation, and therefore it's up to us to keep on advancing this. So nothing that we do is ever static, both in terms of breadth of content that we're getting out there, being able to deliver different scenarios that teach different things, but as you say, particularly in terms of technology, and saying, okay, how do we drive this forward in terms of, it's relatively easy to bring in hand control, to do procedural scenarios, so you can teach people how to put in IV lines, how you can teach people to put in catheters. All of those things are coming through. And equally, lots in the space of natural language processing, voice recognition. I said that virtual reality wasn't yet ready to teach the fineries of communication skills. We are progressing it to a level where actually it can teach you the basics really quite well in terms of voice recognition and communication skills. So there is becoming lots of different ways of delivering this, and absolutely we are at the forefront of it. So it's an exciting time.
Yeah. No, I think it's definitely something we'll revisit with you, Jack. Maybe at some future events. We'll invite you into Northampton because our Wi-Fi and connectivity here is amazing.
I'd love to be there.
Hopefully next year, the Merge Futures event, we'll do it from the university again, the Learning Hub. So we could have a live event for that one. And then someone in the chat as well, they've given a shout out to VR therapies. That's Rebecca Gill. We've worked with her before. She's presented for us. So she's building her studios at the minute in Northampton. So she's going to have some hydrotherapy pools for older people, disabled people, any sort of learning disabilities. And she's got the VR content that was built by the university, and it simulates swimming with dolphins. So you can be in the pool, you've got your headset on, and you think the dolphins are with you. You know, it's an amazing kind of thing that she's doing with VR therapy.
I love it. And I think I've obviously focused on VR purely for training and education. VR in healthcare is used broadly. So yes, it's used for training, it's used for teaching patients in VR, and it's then used for therapeutics. And that idea of a kind of relaxation and distraction therapy is very good. It's also used for other things like movement and balance disorders, training people up after they've had strokes with physiotherapy angles. So the digital therapeutics using VR is a fantastic use as well. I'm all very much for it.
Yeah, great. Well, I think we'll wrap it up there, Jack. Really appreciate you taking the time today to come and talk to us. All the presenters today. Shelley, she's just turned her video back on. Thanks very much, Shelley. Rory and Hugo earlier. Is a real big commitment for everybody to come and present today. We'll post all the videos and the presentations out probably next week. And if you want to keep an eye out for our next event, Tech at 10, I'll just